Hello, friends. Welcome to A Little View podcast, the podcast where the perspective may be small, but the conversations are anything but small. I'm Gwen, your podcast host, a soon-to-be dietitian, a health coach, and an advocate. This is a podcast where we talk about things that aren't talked about. We're the voice for the unrepresented. We're having empowering conversations about healing your mind, body, and soul. And we're bringing on guests to share their inspiring stories. This is A Little View podcast. And I just want to say a little disclaimer that this podcast is for educational purposes only. It is not medical advice. Always talk to your doctor about your own health journey first. I just want to say two things before we jump in this episode. One is, if it sounds a little off in the beginning, I'm not sure what happened to my mic and it was seeming a little screechy in the beginning. So I apologize for that. And it's not the whole episode. So you kind of just have to roll with it for 30 seconds and then it's over. And then I also want to say thank you so much for Dr. Huser for being on this episode, because while he was recording, his throat was not feeling good. And he was like, I feel like by the end of this episode, I'm going to lose my voice. So I just want to thank him so much for taking the time to record this. Today, we have another doctor from the Paley Institute in Florida. We have on Dr. Huser, and a couple things that Dr. Huser specializes in is deformity corrections, limb lengthening, osteotomies, decompressions. He primarily works with people with skeletal dysplasia, such as achondroplasia, hypo, and pseudo. And he is originally from Wisconsin. Wow, that was a mouthful. But before I tell you anymore, I would love for Dr. Huser just to explain and tell us a little more about himself.
My name's Aaron Huser. I grew up in Wisconsin, like you said. That state is a mouthful to say, but it's my home state, and I have a great connection with it. I've lived all over the country. I did a residency in orthopedic surgery, and then a fellowship in pediatric orthopedic surgery, and then a second fellowship down here at Paley Institute in limb deformity, limb lengthening. After that, I've actually worked in multiple places now, including Gillette in the Twin Cities in Minnesota, and as well as a short stint at Washington University in St. Louis. And now I'm back in Florida. Married, I have two little girls who are 3 and 5, and they are really everything in my life. I love them very much.
And what got you into more working with underrepresented communities?
I'd like to consider myself an inclusive person. And I just remember growing up, I always felt like I was out of place. And I think when you have a different problem, that can always make you feel out of place. And I always had this feeling like I never want anyone to feel like they're not included in a group event or an activity. And that's actually one thing that I've been trying to do with my kids too, is always make sure, like, if there's a kid they see who's by themselves and they're in a group, they need to invite that child over to have fun, because everyone's going to have more fun together than if we're all separate.
That's really amazing. I love that. And what would you say is the most common surgery you perform?
Gosh, I'm probably removing osteochondromas from kids with multiple hereditary exostosis, which is a condition where you're growing bones sort of where you shouldn't grow bones on you grow them on your leg, but then they grow out. So they grow out and you see all these bumps on their body. And I remove a lot of those. I decompress nerves around them. I cut bones to reorient their mechanical axis in their leg and in their arms. I take care of the whole body when you're taking care of that condition, much like achondroplasia too. You do a lot of different things in different places.
And then in the skeletal dysplasia community, would you say you do a lot of arm lengthenings?
Do a ton of arm lengthenings. That's probably my favorite procedure to do. The arm lengthening is probably the most functional lengthening that we do. And I think many people are happy after they have it. And the literature, people have written articles on it that say, hey, this is a really good operation to improve function.
And can you explain to me why someone, for instance, with skeletal dysplasia would want to have arm lengthening?
Yeah. So number one, it just allows you to reach things that you can't normally reach. The other part is hygiene issues. In achondroplasia, for instance, if you have spinal stenosis, which is very common, and you undergo fusion, some of the things you used to do, like Taking care of yourself after you go to the bathroom is a lot more difficult, and arm lengthening makes it possible, sometimes even obviating the need for special tools to help clean up after using the restroom. So I just think it's like functionally the one of the best things we can do.
Yeah, I've had, I would say, maybe a handful of friends get arm lengthening done by you because they had spine surgery, and that they said it's the best thing they've ever done in their life.
I think too, it's like as you're doing it, you're noticing the change where many of the surgeries, it's like we did the surgery, now you're waiting to heal. This one, you're still healing, but you can do stuff while you're going through lengthening. You can do stuff while it's healing too. And I think that's so helpful for people.
And can you walk me through how it works? Like, how exactly do they get more length in their arm?
So with achondroplasia, pseudoachondroplasia, most of the skeletal dysplasias, the arm isn't long enough to use an internal device like a nail in the bone. So we have to use something on the outside. The surgery is about an hour of our time. We put 6 pins in, 3 in the lower segment near the elbow, and then 3 near your shoulder. And we cut the bone through a small incision. It's actually probably like a centimeter to a centimeter and a half. And then we attach what we call a rail, which is just sort of a rectangular device that slides over the pin. Usually at a week, 5 days or a week after surgery, the patient will start turning it for 3 or 4 clicks a day, which is about a quarter of a millimeter each click. So you get a millimeter a day. 10 or 12 centimeters is where we go. Some patients have opted for a second lengthening, um, and they will use a nail on the inside. The nail usually can only get about 5 centimeters. So this device that we use, it's called an external fixator. It gets twice as much as the nail when you're lengthening. And that's why we like it too. It's like, hey, if we can just do one lengthening, I'll take it. The 2 lengthenings is a lot on somebody. And if we can minimize the amount of treatments that someone gets, we're all for that.
And this sounds dumb, but so if they get 10 centimeters the first time, what is that, like 5 inches? I work in inch.
That does not sound dumb. That's how most people work. 10 centimeters divided by 2.5 is about 4 inches.
Okay. Okay. That's quite a bit. I mean, it might not seem like it, but that's quite a bit.
Yep. I think it's a fair amount. You look at the x-rays. My favorite thing is when you put x-rays side by side. So a patient before lengthening and then you get them after lengthening, they're like, oh my gosh, it looks so much longer. And the truth is, it sometimes doubles their arm length.
That's crazy.
Yeah.
And what would you say is like the recovery time? Because they have it on, and they get the tones, and then they get it off right away, or the bone has to heal, correct?
Yeah. So if you think you're getting, let's say we're going at 1 millimeter a day, that's in 30 days, you'll have 3 centimeters. So in 3 months, you have 9 centimeters plus another 2 weeks, you're at about 10 centimeters, right?
Okay.
If that's the case, it'll usually come off at around 7, 8, or 9 months. I tell everyone, think about you're going to have this on for 9 months. And then when it's like ready at 7 months, they're really happy. And so that's great. But if you just think you're going to wear this thing for 9 months. We do call them angel wings because they look like sort of wings coming off your arms. Depending on how old you are, you may like that or you may not like that. One of my partners that I worked with at Gillette used to say, lengthening is like you have this bubble gum and you want to pull it without it getting too skinny. So if you pull it really fast, it's going to get too skinny and break. So you want to pull it slowly so it keeps the width. It looks like good bone. So we get x-rays every, 2 weeks, making sure, okay, the bone looks good. Continue on your way. Oh, slow it down because the bone doesn't look so good. So there's a lot of back and forth, making sure that you're getting really good lengthening. You're growing good bone.
Okay. Let's say you said they're not going good bone. Do you ever have to stop them before they can do like the full amount per se?
Yeah, we've had to stop, but sometimes it's just like you stop for a week and then you restart.
Okay.
The only reason why I would stop, like, prematurely, one, patient says, "Look, I've had enough, I'm done with it." Because you do get pin site infections, I would tell you, say, like, 100% of patients, at some point, we're gonna prescribe an antibiotic, you're gonna have redness and pain around a pin. Take the antibiotic, it goes away. Some patients have more, some patients have less, and it probably has to do just sort of like the bacteria on our skin and the genetics of that bacteria in our skin. The other thing, someone would be like, "You know what? I just don't want any more pin site infections. I'm good with this. I'm done." I don't think it's that painful. I've never had it done, but most patients tolerate it pretty well the further they get into it. And that can be very different than when we're lengthening the lower legs. The lower legs tend to get very tight because you're lengthening against your quads, your hamstrings. Up here, you're really lengthening against your bicep and your tricep. It's just not as strong as those other muscles. Seems to lengthen easy, a little bit easier. So another reason I would stop is that they're not making good bone at all. I've never had that, um, but that could be something. Uh,
And do you recommend for someone to get arm lengthening? Sometimes with leg lengthening, they say it's better to get it done at like a younger age, to start it at a younger age, because obviously your bones heal quicker. Can arm lengthening a person really can get it at any age, would you say?
yeah, I mean, I think any type of surgery is better in a younger person because our biology is better. I think the older we get, the harder it is, but like in your teens, early 20s is all the same. I do think that any type of elective lengthening surgery is a personal choice. So I would wait till ideally or 11 to do a child's arms. Have we done it younger? Yes, for different reasons. If there's spine is fused, it's just like they're more functional if we do it, so let's do it earlier. But I do want them involved. I want their buy-in to do it. A 10-year-old can't consent, but at least they can be like, okay, this is something that I want.
I feel like if I was younger now, I would 100% get that surgery because even though I've never had spine surgery, it just makes everything easier. I've had leg surgery and it's different not being able to use your legs. Like you can still use your arms when you have the fixators on.
Yeah.
But would you say when you get them off, when I got my fixators off my legs, I had to like slowly weight bear. It had to be like 15 pounds. So if let's say someone was weightlifting or any of that, they can't just jump right into it, right?
No, no, I wouldn't. We encourage patients to do wall push-ups. Getting blood flow in your arms when you're doing it helps with the healing process. It helps with pain control. It helps with motion. The when we take off the fixtures, you take them off, but actually we throw a rod down them. And the reason why we throw a rod is a couple, maybe like 5 or 6 years ago, um, we had a kid who fractured after fixation removal, and we do not want that to happen. So we just throw a rod down it to protect it. But I wouldn't lift anything heavy probably for another month because the bone is still maturing. It's still getting bigger. And now you remove the fixer. So now it's actually seeing some more force so it can get stronger.
And do you remove the rod or is it
We don't. It's totally buried in the bone. Nothing is sticking out of the bone. So it's just there. It won't cause a problem.
and you mentioned about they should do like maybe push-ups or something like that to get blood flow. Is it recommended for them to do physical therapy as well?
Yeah, we do, but it's not the same as any leg surgery. So a lot of kids will have them see occupational therapy when they're here, but when they go home, as long as they're just working on their arm motion, so flexion extension at the elbow, and
Yeah.
then pronation supination, which also happens at the elbow, turning your palm up and down. What is the biggest risk with this surgery is the radial nerve. This is a funny nerve because it comes, if you imagine from your armpit and it goes behind your humerus, it's the upper arm bone, and then it curves around on the outside and comes to the front of your elbow.
Mhm.
And so as it's curving around, your pins are at risk for wrapping up the nerve or pulling on soft tissue that then strangulates the nerve. I've had that happen once, had to go in, find the nerve, decompress it. And it took 10 to 12 weeks, I think, for the nerve to come back, but it did. We still ended up going through lengthening and all that stuff, but it's definitely a risk. And so all the time we're asking patients to give us a thumbs up because that's showing that that nerve is working.
That patient you were talking about, their nerve didn't work. Can they, like, not use their arm? What happens?
They can use their arm, but they can't pull up their wrist. It's called a drop wrist.
Eh,
They can't extend their fingers. And so we make a splint and then we just watch it, which is, hard, but once they start getting a flicker, it's great.
yeah,
It's
because 'cause I'm
it's not
sure
that
it
the nerve is cut, it's that the nerve gets stretched or sort of like squeezed too tight.
mhm,
And so
yeah,
then nerves shut off and they heal at about a millimeter a day too.
because I'm sure, like, I remember even with my leg surgery, like, any little thing, you're like, "Oh, this is done." So I'm sure that's just scary, like you said, for
But
everyone.
yeah, it's scary for everyone. That patient we were able to start lengthening right away because the nerve was intact. So we started lengthening and that patient did well.
And then, a patient staying there for it, do they need to stay the whole duration
No,
of the lengthening?
nope. No, we usually stay I like 4 weeks. I just wanna see that we don't, heal too quickly because that can be a problem. Um, but yeah, somewhere between 2 and 4 weeks, and then we usually check in every 2 to 4 weeks with X-rays until they're, done lengthening.
So, the first half of the episode was talking more of the technical part of just lengthening and how the whole process is. Now, the second part is going to be talking about the human experience, what the human feels, and how this truly impacts a little person's life when we're regarding confidence, when we're regarding community. And obviously, we all feel very different about this particular subject. When we talk about this, I just want to say that I am not trying to persuade someone one way or another. I just want to bring light of a conversation that is so often shamed or not being able to talk about. And obviously, you're not a little person, but you've seen multiple people with skeletal dysplasia. And it is very frowned upon, lengthening of any sort, even though it can be a good thing. What is your feelings about that, especially from seeing patients that were going from having a hard time with hygiene to now being able to do the self hygiene a lot easier now?
Yeah, it's still an elective surgery. It's still a surgery that is a lengthening, like you said. My whole goal is to create an environment that patients can ask about this stuff and not feel like I'm judging them or someone else in the room is judging them. I won't say you should get lengthened. I would never tell someone that. I think that's a bad idea. I do think if you're talking about spine fusion, spinal stenosis, then I think, you're probably going to end up getting your arms lengthened. At least we see that in our practice. I know that our practice is very different too. Um, but it is a personal decision. People should know that it exists, but should not feel pressured to get it unless they themselves are the ones that say, I want to do this.
Yeah. And you said most of the time it's kind of like brought up when a patient needs spine surgery. Does a doctor usually say, like, hey, maybe you should get this?
Yeah, we do. We just had this example, I think 2 weeks ago, where, this young person does have some signs and symptoms of stenosis. Are they ready for their big spinal surgery? I don't think so. If we're not going to do this yet, could we do the arm lengthening so when they get the fusion,
Yeah. Yeah.
they're right there. And this is for people who are like, oh, they're sort of borderline on the spine, needing spine surgery. And I think that's rare. A lot of times we see people at, I need spine surgery today. There's not like, okay, well, we'll do your arms first. That doesn't happen. But in these cases where it's probably going to happen, then I think, talking about it is really important because it's going to come up after. And it's like, why live for a couple of months, 6 months, a year where it's really difficult to do stuff if we can get ahead of it?
Yeah. Cause I know multiple people who, again, no judgment, but like I know multiple people as well who have back surgery that have never gotten their arms lengthened. And I just am like, it's doable, but like it's not fun. I feel like it would make everything a lot harder. I do something even harder when we already live in a world that's hard for us. So even to
Totally
add
agree.
more hardness, it's like, why do that to yourself? And but I
Yeah.
just think people are scared to get it because they are afraid what people think when like this is their life and they should do something to increase their quality of life and not care about what other people think.
Totally agree. I think within the achondroplasia community, spine surgery, look, spine surgery is scary within any
Yeah.
community, right? But
Yeah.
within the achondroplasia community, so many people talk about how you get one spine surgery, you're going to get another, how it changes your life. And so people wait for it and they wait till it's too long, which is the big problem. I think having this idea like, hey, if I have the spine surgery, I can still I can still do stuff because I can get my arms lengthened or that type of idea it's a better way to think about it because look, you shouldn't not get spine surgery because you're worried that your back's not going to move. When it's like, yeah, but you may not be able to get control when you go to the bathroom or you may not be able to get out of bed. That's a bigger problem than your back not moving. And if you know that there are other tools out there that can help you, maybe it helps people get the operation they need to decompress their spine, which is really, that is a function preserving operation. So it's tough. We need to create a culture that allows us to talk without being judged, or without us being like, you're turning your back on us if you do this, because that's not true. You're doing something for yourself. You can still advocate for, whatever condition or whatever you want to advocate for, no matter what you have, if you get an arm lengthening surgery. And that's we just got to like stop having those attitudes that, oh, you're turning your back, you're not one of us anymore. It's just like, no, we need to include, goes back. We need to include people
Yeah.
like, especially in these groups, it's more people, the better for everybody. We go further with more,
I feel like people take it, like you said, as a personal.
and you're in charge of your body, not
Yep.
somebody else. I mean, that's the truth. Now what I will say is, if I told you that there are no problems with arm lengthening, it's just a great surgery, there are no complications, that's not true either, and that's misleading. And so when you talk about arm lengthening or leg lengthening or spine surgery or osteotomies, you have to talk about what can happen and how it may not be. You have to set the stage so that there's a realistic expectation for what this intervention is going to do. For instance, many patients with achondroplasia can't fully straighten their arm. We can change that a little, but lengthening doesn't change if you can straighten your arm or not, you know? And so I think like realistic expectations. So I try to undersell, if you will,
Mhm.
or, I don't want to say like this is the greatest thing ever. You're only going to be happy because it's still a surgery that hurts. You're wearing a frame for 7 to 9 months. You're fighting infections. People are going to look at you when you have your frames on if they're not covered. Like none of this is easy, but I do think it's worth it if you're willing to go through that, but it's not easy to go through that, you know?
For sure. Especially when, like, let's say you live in Michigan and not lovely, lovely Florida, and it's -6 out. So, like, trying to bundle up with that on is
But yeah,
pretty
I don't
difficult,
even know what a frame would feel like in that cold. I bet it feel different with a frame in Florida versus a frame in Michigan in the winter,
I'm
you
sure.
know?
Yeah. Yeah.
Yeah.
And would you say a lot of those patients that come back to you from having their arms lengthened, you can tell their confidence is up and they just seem like a different person?
Yeah, I think most of them seem happy. I mean, I think that's like always the thing when it comes to functional outcomes of like limb lengthening. And this is sort of switching gears to like leg lengthening. you know, the functional stuff isn't as good as arms, right?
Mhm.
But it is again a personal choice, and self-esteem is really important. Mental health is important. Lengthening your legs doesn't change that you have achondroplasia.
Yep. I agree.
But if you feel better, then you know what? I want you to feel good. I do not want you to be depressed. I do not want you to be self-loathing. I want you to love yourself. And if that's part of the process, then that's all that matters to me.
And that, my friend, is what we like to say off the mic, Dr. Huser. He really hit the nail on the coffin.
And the only person who can make that decision is the person who's having it. And self-acceptance is one of the most important things. And, with that comes a lot of power, empowerment when you have self-acceptance.
For sure. Not saying this is the reason why you should get surgery, but I think even having this too is like when I had my leg surgery, I had a little bit of lengthening, but it was more just correction of my bowing. But like those surgeries, I feel like after them, you become a completely different person. It just changes you as a person. Just because, I mean, like so many people would tell me, "Oh yeah, I had my leg broken." I'm like, "No, you didn't have your leg broken like me. Like, stop. Please stop talking." So, like, I just feel like it makes you a like a much but it gives you confidence, but in so many different ways because you just who goes through a surgery and those fixators on their legs or their arms for 9 months? Like most of the time, people have a cast on their leg. It's done, couple months, we're done. Like I keep saying, like it just makes you a different person all around.
Yeah, totally.
Like this is what I really wanted to focus on just because again, so many people that I know have gotten lengthening
Yeah,
from you. My last
yeah.
question, something I always ask, what advice would you give to someone who is considering lengthening to improve their quality of life, but they're kind of nervous about will people judge them or not?
Talk to people in your community who have had it and ask them, were you worried about that? Did it change after you got it? How do you feel about yourself? How does it change you? Do people treat you differently in the community now? And you have to understand what's important to you, as an individual. And that's why I think the older, it's nicer if you get it done a little bit older because you can make some of those decisions instead of your parents making those for you, where it's harder to understand. This doesn't, what I'm about to say doesn't really mean something, but I've never had a person who's gone under humeral lengthening is like, I wish I didn't have that done.
Yeah,
I've never heard someone say that.
for sure.
And I think also easier said than done is you shouldn't care what people think about you, and I wish I could tell my 12-year-old self that and my 10-year-old self that, and we all go through that, and when you're born with a different condition, it's worse. Was not a fan of high school, of middle school. Those are just rough times, and I'm average stature, and I can't imagine how that time could be for someone who is an average stature because it's already hard already. But in the end, if you learn to just like accept yourself and love yourself, it makes life so much easier because your decisions are following those values.
Yeah. And not to keep reiterating that point, but I think it even makes it harder when you're trying to accept yourself. You live in a world that's not accepting. And then on top of that, if you choose something to better quality your life, then you're even secluded from the people that are
Yeah.
just like
Your
you.
community is like, why
Exactly.
did you do that? Yeah.
Exactly.
Yeah. We always talk if we could just change like how society, if we didn't see things the way we see things and we would say like, it's okay to look different, to be different because it is. The truth is it is okay. But for some reason, people are so insecure with themselves that then they come down on other people. It's just not right, you
Exactly.
know? And
Yeah.
it's always based on someone else's insecurity, not based on yours. And that's the
Yeah.
crazy thing.
Yeah, it's usually something they're self-conscious with, and they're blaming it on you when it has nothing to do with you.
Yeah.
Well, thank you so much for being on my podcast, and I know this was very specific, but like I said, I think this topic
It's
is
all
just
good.
so important. So thank you again so much, especially when you are a surgeon, also you're a dad, and you have hobbies and things you'd like to do. So thank you for taking time out of your life.
Thank you for having me. I really appreciate you asking me to do this.
Hope everyone that's listening, they get some insight out of this. And again, I think the biggest message is choose what's best for you, no matter what it is. No one's pushing you one way or another. We're just giving you information. I hope you guys learn that during this episode, and we'll see you guys next time. Bye.
Bye.